In this video, we will talk about a very common problem in girls, called premenstrual syndrome. We will also talk about its severe form, called premenstrual dysphoric disorder. What is PMS? Premenstrual syndrome is a group of cyclical symptoms that begins in the luteal phase, premenstrual phase, of the menstrual cycle, and ends when the menstruation ends. Prevalence of PMS affects approximately 75% of menstruating women to some degree, having a negative effect on their personal or social life. To understand PMS, we should have a short overview on menstrual cycle. There are 4 phases of menstrual cycle: menstrual phase, shedding of the uterine lining; follicular phase, follicle development in the ovaries; ovulation, release of an egg from the ovary; luteal phase, post-ovulation phase, where symptoms of PMS occur. Symptoms of PMS. The symptoms of PMS occur in a cyclical order, as they are syncing with the beginning of each menstrual cycle. There are 3 types of symptoms in PMS: physical symptoms, emotional and behavioral symptoms, cognitive symptoms. Number 1. Physical symptoms. They can manifest as bloating, breast tenderness, headaches, fatigue, weight gain, muscle or joint pain. Number 2. Emotional and behavioral symptoms. Mood swings, irritability, anxiety, depression, crying spells, sleep disturbances, changes in libido. Number 3. Cognitive symptoms. Difficulty concentrating, memory issues. What is the pathophysiology of PMS? Following factors may play a role in causing PMS: hormonal fluctuations, changes in estrogen and progesterone levels, neurotransmitter changes, impact of hormonal changes on neurotransmitters like serotonin, genetic factors, family history may play a role, lifestyle factors, stress, poor diet, lack of exercise. Diagnosis of PMS. The cyclical nature of PMS is the gold standard for diagnosis. Following tests can be done for confirmation: clinical evaluation, based on symptoms and their timing, in relation to the menstrual cycle; symptom diary, keeping a record of symptoms, over at least 2 menstrual cycles; exclusion of other conditions, rule out other potential causes of symptoms, such as thyroid disorders, depression, or chronic fatigue syndrome; management and treatment. Following steps can help in PMS. Step 1. Lifestyle modifications. Dietary changes: reduce caffeine and sugar intake, reduce alcohol intake, increase complex carbohydrates and fiber, limit salt to reduce bloating. Exercise: regular physical activity to reduce symptoms and improve overall health. Stress management: techniques such as yoga, meditation, or counseling. Step 2. Medications: over-the-counter pain relievers, NSAIDs like ibuprofen or aspirin, to alleviate pain and discomfort. Hormonal treatments: oral contraceptives to stabilize hormonal fluctuations. Gonadotropin-releasing hormone agonists in severe cases. Antidepressants, SSRI or SNRI for mood-related symptoms. Step 3. Alternative therapies: use of supplements, calcium and magnesium, vitamin B6, evening primrose oil. Herbal remedies: chasteberry, ginkgo biloba, and St. John's wort. Acupuncture and acupressure, for pain relief and stress reduction. Severe PMS. Premenstrual Dysphoric Disorder. Definition: a severe form of PMS, characterized by significant mood disturbances. Symptoms: similar to PMS, but more severe, including marked depression, anxiety, irritability, and mood swings. Diagnosis: based on the severity of symptoms and their impact on daily life. Treatment often involves a combination of lifestyle changes, medication, and therapy.